Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Indications of hospitalization in pelvic inflammatory disease. Indications for hospitalization include pregnancy, surgical emergency like appendicectomy if it cannot be ruled out, tubo-ovarian abscess. Oral treatment can be done. For in pelvic inflammatory disease, if you have given oral treatment, but even after giving oral treatment, if there is no response, then you go to parenteral treatment or admission. Or if the patient is not able to take oral drugs due to nausea, vomiting, or high fever, in such cases you will have to go to parenteral therapy. If the patient is not compliant, then we do parenteral therapy. So, regimens of parenteral therapy include regime 1 includes cefotroxin, first cefotetan 2 grams is given intravenously every 12 hours along with doxycycline 100 milligrams orally or intravenously every 12 hours. Regime 2.
So, cefotetan 2 grams IV 12 hourly and doxycycline 100 milligrams BD orally is given regime 1. Then regime 2.
Cefoxitin 2 grams is given intravenously every 6 hours with doxycycline 100 milligrams twice daily intravenously it is given.
So, cefoxitin is given 2 grams intravenously 6 hourly and doxycycline is given 100 milligrams BD IV.
thank you and thank you for watching.